Hey guys, today we'll be talking about nutritional support, enteral feeding, parenting, nutrition as a. So what is nutritional support? Nutritional support is meeting a person's, an individual's nutritional needs and their optimum nutritional status through the means of enteral feeding, parental nutrition, and diet supplementation, or even a combination of these. So what is enteral nutrition? This is fulfilling a person's personal nutritional needs whose digestive tract is intact, right? So the nutritionists are meant who aren't able to fulfill their needs through their normal oral routes sufficiently, or who are unwilling to fulfill such needs efficiently. So what are some indications for enteral feeding? Some indications for enteral feeding will include those patients who are depressed, who have anorexia, which is an eating disorder, for those who have dysphagia, which is trouble swallowing, for also patients who are transitioning from parental nutrition. Another indication for enteral feeding will also include those who are suffering from certain injuries, malnourished, and etc. There are many other indications for enteral nutrition. Also, those who have neurological conditions such as coma, stroke, also those who have facial pain, face, neck injuries, etc. Right, so these are indications for enteral. One contradiction for enteral feeding will be for a non-functional digestive tract. So we want to make sure for enteral feeding that a person's digestive tract is functional, right? So this is the contradiction to enteral feeding. We also want to look at the types of feeding tube, right? Methods. So we want to look at the commercialized method in which we use certain formulas. We may use Ensure, Boost, and whatsoever. And we also have the blenderized method in which we use freshly prepared meals to satisfy individuals' patients' needs, right? So with the blenderized method, we want to make sure that when it is we serve food, it is at room temperature. Also, if it is that it's going to be stored, it's refrigerated 35 to 45 degrees Celsius. We also want to use fresh food, right? Food freshly prepared. We want to use raw food when serving individuals with blenderized feeding. We want to move on to types of feeding, right? So we have the nasal gastric, in which the tube is passed through the nasal cavity, the esophagus into the stomach. This is the nasal gastric feeding route, right? We also have the nasal duodenal, in which the same procedure passes through the nasal cavity, going down the esophagus, into the stomach, into the duodenum, which is the first part of the small intestine after we pass the esophageal sphincter, going down after the stomach. Yeah, the first part of the small intestine. So we also another feeding route will be the gastrostomy, in which this is a surgical procedure actually. We also have the Jejunostomy, in which the same procedure with the endoscopy is used to see where the surgeon is going and where the tube should be passed through, so that will be clearly identified to place in the tube correctly and efficiently. So we want to now look at some delivery methods in which we will deliver these meals. We'll feed the patients. We have the bolus method, in which patients are fed 46 times over a 20-minute period with 300 to 400 mils of feed. We also have the intermittent drip method, in which an individual is given a prescribed feed over a period of hours or whatsoever. We also have the continuous infusion, in which individuals are given feed from a range from over 24-hour period. It is flushed every 4 hours with 50 mils of warm water, right? So this was for the continuous infusion. We also have parental nutrition. What exactly is parental nutrition? This is when we administer the appropriate nutrients to patients whose digestive tract is not intact, who have non-functioning digestive tract, right? We administer such feed through IV, intravenously, right? Through the central vein or the peripheral vein. We also use the subclavian vein as well. And such nutrients that are delivered are amino acids, fats, proteins, etc. Right? So these ideal post-operatively and pre-operatively. Right? So these are some indications for parental nutrition. Will include those who have non-functioning digestive tract, which I've mentioned there, Crohn's disease, paralytic ileus. Also for those who have certain intestinal diseases which require strict bowel rest. For those who have pancreatitis, which is inflammation of the pancreas, and when this process occurs, certain enzymes and digestive products are released, which can potentially cause damage to surrounding organs. And also for those who had certain intestinal surgery. Intestinal dissection is basically an operative procedure in which an affected or a diseased part of the colon or the intestine is removed surgically. So what are the stages in which an individual progresses to a normal diet? These were the basics of nutritional support. Thank you for watching. Please don't forget to like, share, and subscribe.